Well, thank you. Current state of mental health in Ghana, with respect to resources, is still poor. We don't have adequate resources. I'm talking about adequate numbers of psychiatrists, adequate numbers of clinical psychologists, adequate numbers of, maybe for the psychiatric nurses, we are not exactly, but that's fine. Psychiatrists, we have, as we speak right now, 32 psychiatrists all over the country, about 30 in active practice. And this is the highest number you've ever had in the whole country, ever. Until just about 10-15 years ago, we had only about 10 psychiatrists. So there's been a remarkable improvement. This is largely because now we have our own local college, Ghana College of Physicians and Surgeons. That is one. Two, we've also brought some innovations in their training. Now the Medical Data Council has agreed for the last 5 years or so that doctors who have just come out of school and they are doing their internship can add psychiatry as part of the internship. In the past it was only surgery, internal medicine, pediatrics, and obstetrics and gynecology. 6 months in each of them. And now the Medical Data Council has added psychiatry and laboratory sciences and a few other areas that people can do their rotation in those areas. What we've learned is that, what we've realized is that in school times, the exposure to psychiatry is very, very low. Maybe maximum 4 weeks to psychiatry, the whole period of your training. So they come out without much information about psychiatry, so their interest is not there. But with this training, you can go and do your full rotation of 6 months after your medical school. And by the time they go through, a good number of them become interested that, oh, this is what psychiatry was and we didn't know, so we now want to continue to do specialization in psychiatry. That has added to the number that we are having. Plus, we've also tried to work out the exposure to be longer in the medical schools than it used to be in the past. So a lot of other things. So now we have 32, as I said, as against some 10 in the past. It's still not adequate. Ghana requires not less than 100 psychiatrists. So what you have is still inadequate. Clinical psychologists, we have about 30 in the system. Ghana requires not less than 100. Clinical psychologists, what has happened in the past is that the University of Ghana has been training them, but the Ministry of Health did not have an established post for psychologists. So we therefore could not recruit them. But now the government or the ministry has given an established post for them, so we can recruit them. The only thing is that I think their salary scale is still quite low. So the numbers we have trained in the system, we don't have corresponding numbers coming into the public sector for to practice as clinical psychologists. A lot of them are practicing in other areas like human resource managers and others. So there's a potential to increase the numbers there. Psychiatric nurses, that's fine. I think we have a good number, not less than 2,000 in the country, about 2,000 to 4,000, so that's fine. Occupational therapists, in the past we didn't have a single. Now we have 7 trained by University of Ghana School of Allied Health, and we are hoping that the training will continue. Occupational therapists, Ghana requires not less than 80, and we have only 7, so that's woefully inadequate. So generally that's the trend. There are so human resources, that is improving over the period, but it's not good enough. Financial resources, woefully inadequate. We get less than 1% of the health budget going into mental health, when you require about 6 to 7% of the health budget. The health budget itself is small, I must say. The health budget, we should be getting about 15% of the national budget going into health by what is called Abuja Declaration. All West African states met at Abuja and decided that to improve upon health of West African citizens, the various governments were required to give about 15% of their national budget into health. But we are not getting that. The highest we've ever had was 13% some 10-15 years ago. Now what we're getting sometimes can be as low as 4%. Currently we are probably getting around 8%. So if the national budget, the health budget itself is small, and we are getting less than 1% of the total health budget, which is already very low, compared to the other aspects, then you can imagine what you're getting. So it's really very serious. As we said right now, we don't have any money to be running, and that's really very serious. So in terms of financial resources, very inadequate. So then but if you look at the types of services, apart from the resources, the services themselves, we are improving, I must say. We used to, until recently, until the passage of the mental health law, that's 7 years ago, we used to have largely our services limited to the psychiatric hospitals, Accra and Kaful Pantan, and that means seriously centralized and localized, institutionalized, limited to a small part of the country. Now we've opened up with the inception of the mental health law and its implementation. We now have regional mental health activities going on, so we have regional mental health coordinators, and very soon we are going to appoint district mental health coordinators. So by and by we are extending mental health services into the regions and the communities, and that is very good. We have been able to, I would say, tackle issues of human rights abuses to a large extent, not completely eliminated, but to a large extent. Now we have, by law, banned chainings and shacklings in the prayer camps. What we need to do is to enforce it. And we need a certain committee called Visiting Committee to go around to enforce them. That committee has already been established, but at least for now, some notorious camps have stopped chaining. Though they've tried to find a way out by creating cages. So now they are not chaining in the open spaces, but they put you in what is more like a cage. That is not good enough, but that's the next step that you want to stop. So, but I want to say generally, human rights situations is improving. We have also recently instituted what we call quality rights approach with collaboration with WHO, and that's also training all health and other personnel so that we begin to respect the rights of persons with mental illness. So there are some efforts going on along that line, but we need to do more. So if you ask me the state of mental health in the past, if we had done this conversation, we held this conversation some maybe 5-10 years ago, I would have said we are just about 2/10. Now say about 5/10 if we look at our state of mental health generally. But 5/10 is not good enough. We are capable of hitting about 8 to 9/10, and that's what we are aiming at. So that is where we are now.